welcome to the deep dive. Today, we're going to be looking closely at something that most people probably don't even know exists, the cisterna chyli in cats.
Right.
We've got a fascinating research article here from the Journal of the American Veterinary Medical Association to kind of guide us along. And what's really interesting here is how the structure appears on CT and MRI scans,
Right.
which could be a game changer for vets who are diagnosing conditions like chylothorax.
That's right. Chylothorax is a condition where lymphatic fluid leaks into the chest cavity.
Yeah.
And being able to clearly visualize the cisterna chyli, or CC as it's often called,
Right.
could significantly improve diagnosis and treatment.
So before we get ahead of ourselves, let's start with the basics.
Okay.
What exactly ISS this cisterna chyli?
Well, think of it as a kind of collection point in the lymphatic system.
Okay.
It's a dilated sac-like structure located in a cat's abdomen right along the aorta. Its job is to gather lymph from the abdominal organs and pelvic limbs and funnel it up into the thoracic duct, which eventually empties into the bloodstream.
So kind of like a major intersection on the lymphatic highway system.
Precisely. And it's not just hanging out there in isolation.
Right.
It's surrounded by a lot of other important structures like the aorta, the cranial, mesenteric, artery, lumbar, vertebrae, kidneys,
Wow.
even the adrenal glands.
Okay.
Knowing the location of all these surrounding structures is crucial for vets when they're trying to identify the CC on a scan.
Okay, so it's this little sac tucked away in a pretty crowded neighborhood.
Yeah, you could say that.
But why is it so important to be able to see it on CT and MRI scans?
Imagine you're a vet looking at a CT scan. You see a small shape near the aorta.
Right.
Is it the CC?
Mm-hmm.
Is it an enlarged lymph node?
Yeah.
Maybe even a tumor.
Oh, wow.
Being able to accurately identify the CC is like having a map to navigate this complex area.
Right.
It can help avoid misdiagnosis and ensure that vets are interpreting those scans correctly.
And this is especially important when it comes to diagnosing and treating chylothorax right.
Absolutely. Visualizing the CC can be vital for planning surgery,
Okay.
particularly if a procedure called thoracic duct ligation is being considered.
Right.
This procedure aims to stop the lymphatic fluid leak, and knowing exactly where the CC is located can make all the difference for a successful outcome.
Okay, so the stakes are pretty high.
Yeah.
Now let's dive into the study itself.
Okay.
They specifically wanted to see how the CC shows up on CT and MRI scans, right?
Exactly. This was a retrospective study, meaning they looked back at existing CT and MRI scans from cats that didn't have any lymphatic system diseases.
Gotcha.
This gave them a baseline of what a normal, healthy CC should look like.
So what did they find? Was the CC even visible in these scans?
The good news is yes, the CC was identifiable in the majority of the cats,
Wow.
both on CT and MRI.
That's pretty remarkable.
This is a really promising finding because it suggests that these non-invasive imaging techniques have real potential for evaluating the CC.
That's really exciting. Can you walk us through some of the specifics they discovered about the CC, like its location, shape, all that?
Of course. So in terms of location, they found the CC most often at or just behind the cranial mesenteric artery, typically ventral to the second lumbar vertebra, or L2.
Okay.
Interestingly, the shape of the CC was quite variable. They saw crescent shapes, most frequently followed by oval and even a few triangular ones.
Triangular. That's surprising. I guess our bodies, even on a tiny scale, are full of variations.
Absolutely.
What about size? Were there any consistent findings there?
They found that the average width of the CC was about 2.4 millimeters, but there was a range, of course.
Right.
The study also delved into the specific appearance of the CC on both CT and MRI scans.
Now we're getting to the nitty-gritty.
Yeah.
What do they observe on the CT scans?
On CT scans, they measured something called attenuation,
Okay.
which basically tells you how much the X-ray beam is absorbed by the tissue. The mean attenuation of the CC was 17 Hounsfield units, or HU, before contrast dye was injected.
Okay.
After contrast, it increased to 28 HU.
Interesting.
This means the CC does enhance with contrast, but the degree of enhancement did vary.
Interesting. So that contrast dye really helps it stand out on the CT scan.
Yeah.
What about MRI? What did the CC look like there?
On MRI, it was a bit different. They looked at different types of MRI sequences. On T2-weighted images, the CC appeared iso-intense to cerebrospinal fluid, or CSF.
Okay.
This means it had a similar signal intensity as the fluid surrounding the brain and spinal cord.
Right.
And on T1 weighted images, it was isointense to muscle, meaning it had a similar signal intensity to muscle tissue.
Okay.
So we're starting to get a clearer picture of how the CC looks on these different imaging modalities.
Right, yeah.
And
This study focused on healthy cats, right?
yeah.
I'm wondering how different diseases might actually change the appearance of the CC on these scans.
That's a great point, and it's definitely where future research needs to go. We need studies that compare the CC in cats with various conditions. Maybe a CC with cancer looks different than a CC in a cat with heart disease. Finding those visual markers could be invaluable for vets.
It would be like having a visual dictionary for diagnosing different conditions.
Exactly. If we can see how the CC is affected by different diseases, it could lead to more targeted and effective treatments. For example, a scan that shows a blockage in the CC might point towards a different surgical approach compared to a CC that's simply dilated.
So it's about moving beyond just identifying the structure, but understanding how its appearance can give us clues about what's happening elsewhere in the body.
Precisely. And this is just the beginning. Think about the potential of using CT and MRI to guide interventions, like using real-time imaging to guide a needle during a biopsy or to target the CC precisely during surgery.
That's incredible. It seems like this study has opened up a whole new world of possibilities for veterinary medicine.
It really has. But it also highlights some of the challenges that come with adopting new technologies.
Like what?
Well, for one, vets need specialized training to operate the equipment and, even more importantly, to accurately interpret the images. It's one thing to see a picture, but it's another to know what you're looking at and what it means.
That makes sense. You need expertise to make sense of those complex images.
Right. And then there's the cost factor. CT and MRI machines are expensive to purchase and maintain, which can limit their availability, especially in smaller veterinary practices.
That's a real barrier for a lot of people.
It is. But as the technology advances and becomes more affordable, hopefully we'll see these imaging techniques become more widely available.
And ultimately, that could translate into better outcomes for our feline companions.
Exactly. Earlier and more accurate diagnoses, more targeted treatments, and a better quality of life for cats. That's the goal.
I love it. So as we wrap up our deep dive into the cisterna chyli, any final thoughts for our listeners?
This study really highlights how important the lymphatic system is for a cat's health, even though it's often overlooked.
And it seems like we're just scratching the surface of what CT and MRI can tell us about this complex system.
Absolutely. There's still so much more to learn.
So what's the burning question now?
Well, the burning question is, how can we best utilize this knowledge about the cisterna chyli to improve diagnosis and treatment of challenging conditions like chylothorax? There's so much potential here.
Yeah, it's fascinating to think that we're just beginning to understand the full potential of these imaging techniques
Right.
for evaluating this one tiny structure, the CC. Imagine what other mysteries we can unravel within the lymphatic system using CT and MRI.
Exactly. There's a whole world waiting to be explored. Think about the potential benefits for cats. If we can gain a deeper understanding of how the lymphatic system works, how it reacts to disease, and develop more effective interventions, we can truly make a difference in their lives.
That's a fantastic thought. So for all you cat lovers, vets, and curious minds out there, keep your eyes on this field. It's moving fast, and who knows what amazing discoveries are just around the corner.
In the meantime, from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.